Hi guys, this is Dr. Bhupesh once again for you from Dr. BKM Institutes. Today we have recorded the basics of listening. So there would be a video by the name of Basics of Listening. Please watch that video of today only. Then there would be another video in which we have covered all the tips and techniques of listening part A. As you know, listening is the latest challenging that people are facing. So it is very important to go through these listenings. And in this video, I am doing listening part C, and at the end of this listening, you will find that video of basics of English and listening part A as well. So please watch these three videos to make your listening perfect. And now I'm going to take this session. Please subscribe our channel if you have not. Our contact number is 76967342256. Most importantly, when you want to practice listening, don't worry about the atmosphere, about the place. Just go on the, anything. Suppose here you go on the YouTube, you write anything. So you write OET listening, and whether you are traveling in a bus, you are doing some housework, you still can learn OET listening. So OET listening, you type it like that, and you can do any of the listenings like this and practice any listening. And you don't need even pen or paper. You do not need even pen and paper. You don't need even laptop. So don't make excuses. I don't have this, I don't have that. Just keep on practicing even while you are traveling, while you are doing anything, rather than making excuses. So now we are going to discuss this listening part C, which you guys have told me that you want to do 31 to 36. So I'm just going to switch on the video so that I can be in front of you, can tell you about different things. And thanks to this institute which has created this listening, and let's see how the session goes. And again, I do not know about the answers, but I will tell you the methodology, how to do it. Let's see.
Extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to...
That is the best part about listening part C. That in the reading part C, you have got 4 options. So the chances of getting right is 25%. Whereas in the listening part C, you have got 3 options. So chances of getting correct is 33% already. So if you can eliminate one of the options, so you have 50-50 chances. So that means listening is not as difficult as it appears. So try to think positive things about it. So if you can eliminate one option, your chances of getting it right is 2. So out of the 6, your chances is 50-50 because you're left up with 2 options. So now out of 6 question, if your luck is even average, so anyhow out of 6 question, 3 should be right. And out of 12 question part C, half the one, 3 plus 3 6, and out of the part BC 9 should be right. Anyhow, if you are having average luck, if you can just eliminate one option and can say okay, this one, even then you should get 9 marks in listening part B and C. Please think positive about things. So you learn elimination, at least eliminate one option, and if you can eliminate 2, third one will become the answer. You will have 100% chances to do that. So gain at least 22 marks or 20 marks from the part A by practicing as many listenings as you want. And in the part B and C, anyhow 8 or 9 marks so are pretty obvious if you do not panic. So please do not panic. So now let's see how it goes.
What you hear. Complete your answers as you listen. Now look at extract 1.
Okay.
Extract 1, questions 31.
So now you will have 90 seconds. What are you supposed to do in this 90 seconds? Please understand, this is very important. Again, read only the questions 31 to 36. What general point does John make about physiotherapy? General point. General word is, again, I have told you in the reading, that is the same rules that apply in listening. That is why I told you in the first video, in the basics of listening, whether you do listening part B or C, or you do reading part B and C, they are almost the same things with the same strategy. That you must know what your question is. You must try to eliminate the wrong option. and then you must try to select the right option. So if you read the question, what general point, it is not saying main point, what general point does John want to make about physiotherapy? John suggests that before treating a patient with scoliosis, the physiotherapy needs this. So underline the keywords. If I have to underline the keywords, I would underline the keyword general point. Scoliosis word I would like to underline, because as soon as the speaker says the word scoliosis, I know my 31st question is gone. Please understand, because sometimes listening goes in a flow and you miss out on 31, 32, then you miss out on 33, 34. You never get to know where was it. So scoliosis word will make it sure that the 32nd question has been started. Then John feels that once scoliosis is confirmed, then confirmed word is very important. The priority for the multidisciplinary team would be my keyword in this question. So also I need to understand the story. This story is about physiotherapy. This story is about scoliosis. This story is about once the scoliosis is confirmed, then multidisciplinary team, what should it do? Then the second phase in the Jones preferred treatment for sclerosis. So second phase is the keyword. Again, these are the special words which tell you which question is being discussed, and the previous one is gone. Second phase, then I will go to the next one. John believes that success in the final phase. Then it comes to final phase, and then it says, so John suggests that patients with mild to moderate scoliosis often. So mild to moderate. So now I understand that my topic is majorly about scoliosis and physiotherapy. First question is about general point. Second question is about treating a patient with scoliosis. What does a physiotherapist needs? Physiotherapist is also a keyword. Third is once it is confirmed. Fourth is about what was the phase? Second phase. Fifth is about final phase. And sixth is about mild to moderate scoliosis. Now I know about the topic, and once it starts speaking, I will start focusing on my question number 1, because in question number 1 I also need to read. I also need to read options as well. So as soon as I wrap up my 31 to 36 question, I understand the basic, that is physiotherapy, it is scoliosis, and the major keywords are general point, scoliosis, physiotherapist. Third, scoliosis is confirmed. Fourth, second phase. Fifth, final phase. Sixth is something like mild to moderate. So now I understand my topic very nicely. So now I would love to hear to what it is saying, and we'll read about the options of 31. Let's see. So that is what you need to use the time as. So first of all, you should know the complete story. 31 to 36, all questions should be read. You do not read about the options, just the questions. Then you play the options. Let's see. So as soon as this mode is on, he's speaking, I would be on the first question. What point general make about physiotherapy?
The physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy...
Now, by the time it has spoken this much, I have read the 3 options. First option is about less invasive form. Second option is about in conjugation, means in combination with other forms of treatment. It places more emphasis on prevention. So I just now know 3 words. Conjunction means combination. Is it about prevention or is it about less invasive form? So by the time he's just speaking this much, I have noted my keywords: less invasive, conjunction, or prevention. Let's see.
Help my condition. Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders.
So prevents. But there are other 3 words as well. This, and prevents. So now C option has less chances until now because it does 3 things. Let's see if it puts more emphasis on prevention, then it's fine. Let's see. And also there should be even if it says it places emphasis on prevention, even then the answer is not right, because my option says emphasis on prevention then other forms of treatment. So it has to be compared with other forms, only then I can do C. Otherwise, I cannot do C. When they will say that physiotherapy has more of prevention tactics as compared to other forms, then I can do C. If it does not compare with other forms, I can never do C. So this comparative degree, there are 3 degrees in English. This is very important for reading as well. Good, better, best. High, higher, highest. Low, lower, lowest. Much, more, most. So you should know bad, worse, worst. So the middle degree, that is second degree, is always a comparative degree. It always talks about comparison. He is worse than you. Worse is never, worse does not mean bad. Worse means than you, than him, than her. He is lower than him. He is higher than him. It is higher than him. That person was greater of a person than him. So this second degree is always about comparison. If they do not compare physiotherapy with other branches, my C option is already out. So this is what you need to know. So it talks about 3 of the things of physiotherapy. I will play it again. Yeah.
As a physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention.
It can be a replacement. So most probably it does not work in conjugation because it replaces. Most probably. I do not know. I'm just telling you what is running in my mind. So conjunction means it should go with the surgery, but it is saying it is replacement. So maybe B option is also out. By the time C is also out, so my answer should be A. But I am not confirmed yet until the word scoliosis is spoken. I am not sure. So I keep on listening to it very nicely until this scoliosis word will come in.
Not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis.
So now I know my 31st question is gone. So as far as I think it should not be C. B, there was one line that he spoke afterwards that made me confused, and also I did not hear to A at all. I did not hear to A at all. I did not listen anything about A, that it is less invasive form of treatment. So again, I would like to listen to it again. But anyhow, if it's my exam, I would have done A or B. But I still, again, I don't want to judge myself, as I told you in other listening. Do not judge yourself. Try to do it correct before watching your answer. Learning is always important than being correct. So let's see.
One I hear most often is, can
So learning is important. Don't go for answers straight away. Try to listen to it again. That is what I am saying. Listening part A, try to do as many as you can. Listening part B and C, reading part B and C. Try to repeat the same reading, same listening again and again to understand the basics. So I'm going to play it again because again, I want to learn. I don't want to judge myself. Let's see.
treats and prevents a wide range of health. As a physiotherapist of 22 years, I've been asked all sorts of questions, but the one I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on a condition that still creates controversy.
Again, now I'm highly confused, but I will still like to go with A. And I don't know, I really want to check the answer now. It should be A, but it can be B as well. I will tell you the reason first, then I will check the answer. So A is my answer because it was said that it replaces surgery. That means surgery is an invasive form of treatment. So it allows the patient to opt for a less invasive form. So it replaces surgery. So, but again, it did not say less invasive. It should have been, it allows the patient to opt for a non-invasive. But it said less, so I'm not quite sure. I'm confused. Then the second option, they said that in some of the times, physiotherapy, again, I'm saying reading and listening is nothing different. Both are information. Now I have a question and I have information. Information now for the second option is that it replaces this, but at the same time, not all the conditions can be solved with physiotherapy, but it can surely help. It can surely help with other treatments. Something like that was said. So that again brings me back to B. So I am not sure about A because less word is interfering, because it allows the patient to opt for a less invasive. Yes, because it replaces surgery. So that can also be my answer. And also it can be B because first he said that it replaces, but at the same time he said it can help with other forms of treatment. Let's listen to it again. Why I am confused. So this question I can never do with surety in exam. So this is the kind of a question that should not upset me. Whether it is right or wrong, I have done my best. It can be either A or B, depending upon my mood, depending on what I can listen to. So I will listen to it again, but here I have a chance. Let's see again. कोई बात नहीं, let's give it time to learn.
As a physiotherapist of 22 years, I've been asked all sorts of questions.
And mind you, please, it is just like reading. Why? Because I have listened to every line nicely. It is not my listening that has caused me trouble. It is selecting the option. Again, it is analytical thinking that is causing me trouble, just like reading. Because I have listened to each and every word nicely. Listening is not a problem for me. So you should know whether listening is causing problem or whether analytical thinking is causing problem. You should at least know about yourself. So in my case, I can listen to it very well. I can listen to each and every word, but I'm unable to relate it to option because I know it is a tricky question. But let's listen to it again.
One I hear most often is, can physiotherapy help my condition? Physiotherapy assesses, diagnoses, treats, and prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do. So today, I'd like to focus on
It is maybe not talking about combination. Help it can certainly do, but not talking about combination. So the only option I'm left with A. I would really like to check this answer before I move forward. I don't know whether you guys are willing to check the answer or not, but now I have curiosity to know. I hope it should be A. I hope. B. E. So again, it went wrong. Can't really help it. But again, I was confused. So I already knew it could be A or B. C, I was sure. Again, I'm saying 50-50% chances. So by chance, it is wrong. Can't help it. But I have listened to each and every word nicely. And A word might be wrong just because less word was not given. Because he did not say that physiotherapy is an invasive thing. So in less or more does not matter. Means it is an invasive form? No, it is replacing the invasive form. So that is why they would have eliminated the option A, because physiotherapy is non-invasive. That's what I know personally as well. This is what I'm saying. It might be due to the tiredness because I have been taking lecture since last 1 hour and 15 minutes talking in English, and that too continuously. But this is the part of learning that I could have done B, but see the time and the mood. So it depends. So you don't have to blame yourself. It's about learning. You should know the right thing. Like I know why my thing is wrong because it is not less invasive, it is non-invasive. And I should have done B because it does not solve the problem alone, but it certainly can help. That means it alone cannot do, but it certainly can help with other things. So that is what it wanted to say indirectly. So again, went wrong, can't help it. Let's see question number 32. I hope it goes, but at least I know that 31st was a tricky question for me, because I listened to each and everything nicely, but I was still confused, because that is what reading does, that is what listening does. This is analytical thinking. So when your reading will improve, your listening will also improve. So please understand this basic concept. Don't worry if you're doing reading part B and C today. If by chance you are unable to do listening, don't worry. If you have done reading part B and C nicely, then it will also improve your listening part B and C. But listening part A, I really believe the people who are lacking in listening 350, they are majorly lacking in part A. Please understand, this question cannot be done in the exam with complete surety anyhow. So this was not an easy question, I already knew. Let's go to 32nd question. I hope whether easy or difficult, I don't know. Let's see.
Move, in particular, mild to moderate.
Sorry, maybe I went too little further.
Extracts.
Okay, let's listen to 32nd. What has happened to the voice? Let me play again.
Scoliosis isn't always easy. Prevents a wide range of health conditions and movement disorders. It helps reduce pain and repair damage while increasing mobility and improving quality of life. In some instances, it can be an effective replacement for surgical intervention. Obviously, not all conditions can be cured by physiotherapy alone, but help it can certainly do.
Now
So
I feel
today-
like I could have done it right. That is why once you know the answer, there is nothing to learn. You can only feel I could have done right. There is no benefit of it. So try to watch the answer as late as possible. As late as possible. It's just out of my curiosity I checked. But try to watch your answer as late as possible to improve yourself, to keep thinking about it. Okay, now the second question.
like to focus on a condition that still creates controversy when mentioned alongside physiotherapy, and that is scoliosis.
As soon as it's scoliosis, now I am reading the question number 32nd.
Can physiotherapy make an impact on someone suffering from this condition, in particular mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. A scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one part of the multidisciplinary network.
As soon as it says multidisciplinary, my 32nd question is gone. Now this was a tricky question again, because listening would always be tricky, but again you can eliminate few of the things to establish whether the cause of the condition has been identified. But it said in one of the lines that sometimes the cause is unknown. So B should not be my answer, because now read the question. John suggests that before treating a patient, it is very important to know the question. Before treating a patient with scoliosis, the physiotherapy needs to establish the cause, but sometimes the cause is unknown. How would he establish the cause? So according to me, B should not be the answer. If B is the answer, then I can't help it. Then to develop a treatment plan on the description of symptoms, I don't think so symptoms word was said. So I think it was saying to determine which of the two main types is being presented. And then it is also saying 33rd question, please relate to, once the scoliosis is confirmed. That means type of the scoliosis is confirmed. The priority for the multidisciplinary team means before that, whatever the lecture was, try to understand the flow of the lecture as well. That maybe it was talking about, first of all, it is important to differentiate what kind of scoliosis is. Once the scoliosis is confirmed, so the first step should be that what kind of, so to determine which of the two main types he is having. So I think it should be C again. I don't know, because 30 again it drops your confidence when 31st has gone wrong and you are also recording it for your audience. But again, I am more about learning. It's not about failing. It's about moving. It's about improving. So I will listen to it again. But according to me, 30 seconds should be C. But let's see.
Exceeding 10 degrees. It can resemble a C or an S shape. Physiotherapy make an impact on someone suffering from this condition, in particular mild to moderate scoliosis? Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. The scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan.
These have definite causes, allows the physiotherapist to create a comprehensive plan. So I think it should be C. If that is not C, again, but again, I will check the answer later on because it disturbs the flow. So 30 seconds, I would like to go with C, at least for now. Okay, to develop a treatment plan based on which type of scoliosis. So not on the description of symptoms, based on the which scoliosis. It should be C. I would really sorry. I'm today in a mood, kind of a mood. Maybe I'm tired, but I really want to check it. 30 seconds. This is wrong again. I don't know what's wrong with this. It's like a difficult listening, I guess. But it said that no more cause is known. Let me listen to it again. I don't know what's wrong.
According to what you hear.
30 seconds again. Let me play again. I hope you all are here. It's just about doing one or two more questions. But again, it didn't that means 31st and 32nd both were difficult questions, and 32nd also I was thinking that it should be C. I don't know where I went wrong. Let's check it out.
Is treats and prevents a wide range of health conditions and movement disorders, in particular mild to moderate scoliosis. Let's find out. Scoliosis isn't always easy to treat, but understanding this condition and its related issues will help a physiotherapist determine the best possible options. The scoliotic spine has one or more curves to either side exceeding 10 degrees. It can resemble a C or an S shape. What makes it difficult to treat is that the majority of cases have no known cause. Two specific types are easier to deal with, however: structural scoliosis, which results from the development of the musculoskeletal system, and functional scoliosis, which occurs from muscle imbalances, leg length discrepancies, and inflammation of the tissues. These both have definite causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one part.
Anyhow was not the answer. I don't know why they have done B, but this seems should have been C, because they are telling there are two types, C and S. One is this skeletal and the other one is this. So it should have been C. But anyhow, let's go to the next one.
The multidisciplinary network.
Again, what I'm targeting now with the next one, because my two questions have been difficult one, and by chance they have been wrong. But let's see the rest of the questions, because I always believe at least 3 to 4 questions should be easy in any part 6. So that is what I'm trying to figure out. Let's see what other questions are, whether they are easy or difficult.
Healthcare professions employed in the treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for
I need to
definite
focus again.
causes, allowing us to create an individualized and comprehensive treatment plan. Physiotherapy is but one part of the multidisciplinary network of healthcare professions employed in the treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for any abnormalities and asymmetry. If scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle.
So if the scoliosis is suspected, then X-ray would be taken to confirm. So, but my question is, once the scoliosis is confirmed, then the priority of the priority for the multidisciplinary team should be. So that is what my question. Once scoliosis is confirmed, so my focus is, once scoliosis is confirmed, the priority for should
Or
be.
severity of the scoliosis. From here,
Okay.
scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle, or severity of the scoliosis.
So A should not be my answer because it is saying once the scoliosis is suspected. It is no saying once the scoliosis is confirmed. So A should not be my answer because it has not talked about confirmation, and A option has already been spoken. So A should not be my answer at least.
Yeah, physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward. I believe a good, multifaceted approach to this is ideally broken down into 4 distinct phases. The first of these, in my program, is pain relief. Although not all scoliosis sufferers will experience pain,
Missed out on something.
is but one part of the multidisciplinary network of healthcare professions employed in the treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for any abnormalities and asymmetry. If scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle, or severity of the scoliosis. From here, physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward.
So physiotherapists work with the doctors to see the best option. With other doctors. So John feels once the scoliosis is confirmed, the priority for the multidisciplinary team should be to agree how exercises word was not spoken. First, I told you it comes with scoliosis is suspected. वहाँ पे suspected word was given. So the answer should be C, that they work out with other doctors to create an option, that to create a plan and how that can be executed. So A should not be my answer, 33rd. B should not be my answer because A is when it is suspected. But my question is once scoliosis is confirmed. C is to ensure patients, or B is to agree how exercises will complement. So it did not talk about exercises at all as far as I have heard. So it should be C, to create an option, how to manage the patient. So that is what is being said. I will play it again to make sure.
Treatment of scoliosis. A confirmed diagnosis comes firstly from a thorough physical examination for any abnormalities and asymmetry. If scoliosis is suspected, then an X-ray will be taken to confirm what's known as the patient's Cobb angle, or severity of the scoliosis. From here, physiotherapists work closely with doctors, including orthopedic spine specialists, in determining the best options going forward. I believe a good, multifaceted approach to this is ideally broken down into 4 distinct phases. The first of these, in my program, is pain relief.
Why I'm not listening to it more, why I'm doing C, is just because now it has started talking about 4 phases, and I knew my 34th question is about phases. So I'm jumping onto the phases, and now I'm reaching to 34th question. Let's see what is 34th question. 33rd, according to me, should be C. But again, now I won't go into the answer because it's making me negative. I don't want to be negative anyhow. So 33rd, according to me, should be C. And now my priority is to find 34th, which is the second phase.
Though not all scoliosis sufferers will experience pain or even discomfort, many do. And for these patients, the provision of pain relief assists with compliance and also with corrective or prevention exercises. Physiotherapists have a variety of techniques for achieving this, such as the releasing of tight muscles through gentle massage, acupuncture, the use of supportive postural taping, and various electrotherapy modalities such as ultrasound. Phase 2 is a particularly important
Now my question is phase 2. Phase 2. Phase 2. That was my question. Now I have to focus. The second phase in the Jones preferred treatment plan for the scoliosis focuses on what is the main focus in the second phase?
for several reasons. It's for rectifying any imbalances through stretching and strengthening exercises. This often still includes taping techniques until strength and flexibility have increased. Physiotherapy here focuses on both sides of the
Now is the word. Focuses on
spine, as well as adjacent areas like the hip or shoulder, depending on what's impacting spinal alignment. The aim is to restore the range of motion of the spine, muscle length and strength, as well as endurance and core stability.
So now 34th is also 33rd also was comparatively easier. I'm like 90% sure it should be C. 34th also is very easy because it is saying it's about covering muscles, this around that spine area, because it was talking about this and this motion and everything. So focuses on regaining full movement in the affected part of the spine. Where is the affected part? Full movement means it will develop on the musculature. It did not talk about any new techniques on the various joints. It did not talk about any other joints. It just talked about spine. C, ensuring that the patient has realistic aims about the output. It did not talk about that thing. It was just talking about, doing this and this with the spine and the muscles around that area. So it should be 100% B. So these two questions I feel is comparatively easy. Even 31st could have been right if my focus would have been right. 32nd, I seriously do not have any idea. According to me, it should be C anyhow. 33rd should be C. 34th should be B as per me. Now let's
stage is paramount for allowing ongoing treatments in phase 3 to occur. This is because it
did not talk about any realistic aims. It did not talk about any new tech. 34th, I don't believe it should be either. So 34th is the only question I have done with utmost surety. I hope 34th should not be wrong. But let's go to 35th, and that would be John believes the success in the final depends upon. So what is the final phase on which success depends?
There that the patient requires the strength and flexibility gained in phase 2 in order to resume normal activities. These include sport and recreation, which is the objective most patients have in mind during the treatment process. It's where we aim to restore full function. This is where we as physiotherapists need to tailor rehabilitation to the specific patients so they can safely achieve their functional goals. This, of course, includes trained
So in the third phase, I hope 34th should be right, because in the third phase, he is saying that it is in the third phase that we talk about the functional goals of the patient. So that should come as the phase 3, the C option. As far as I think, I hope it should be correct, but this is being talked about phase 3. And the question is about second phase. Let's see the question.
Who place great stress upon their bodies. So caution must be taken when giving advice, and strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of
I'm reading side by side long-term responsibility of the patient, ongoing cooperation with the physiotherapy and the patient. What is the final phase? That patient and physiotherapy will be having the cooperation, which is already ongoing, or would they be handling the long-term responsibility, or would be about practical assistance subscribed by the practitioner? Let's see.
This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify...
So it is also easy. Again, 35th should be B, because they are saying relies heavily on physiotherapist, partnership मतलब ongoing cooperation between the physiotherapy and the patient. Again, 35th also seems easy. I hope my 33rd C, 34th B, 35th B should be correct as far as I think, because that is what I know about listening. If 31st and 32nd, again I'm saying 31st should have been right. This maybe I did wrong, that I am highly regretting it. 32nd I do not have any clue. 33rd I feel should be correct. 34th easy. 35th should be easy as well. I will again make you listen. That is why I say listen to my lecture till the end. Don't get disappointed with anything. That is what is power of persistence. You will always find easy options in the end. So don't leave it, yaar. Please learn from it.
This need to tailor rehabilitation to the specific patients so they can safely achieve their functional goals. This, of course, includes trained athletes who place great stress upon their bodies, so caution must be taken when giving advice, and strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions may be utilized.
Otherwise, it's showing A as well, because it's saying that then it relies upon the patient to how to go, but it relies on the partnership. But the word was depends on. So on was the key word. If you do not understand that rely and depend are synonyms, then own word will help you. Again, listen to this. Own word will help you.
Encouragement is needed for keeping to realistic recovery times.
Own word.
The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions may be utilized.
But again, it is again confusing me, because it is saying partnership word. Obviously, I understand that ongoing cooperation, but ongoing word has not been spoken. And then it is saying then it is left upon the patient to take over the responsibility. I would like to change my 35th answer to A, because in the end you will listen, because why I'm excluding B option is because ongoing word is not being spoken. And then it is saying it is left upon to them. Let's listen to it.
This, of course, includes trained athletes who place great stress upon their bodies, so caution must be taken when giving advice, and strong encouragement is needed for keeping to realistic recovery times. The final phase is undoubtedly the most important in terms of full recovery, and this is the prevention of a recurrence. This relies heavily on the partnership between physiotherapist and patient. By this, I mean we identify the optimal exercises for the patient to continue, and it's then up to them to maintain these exercises throughout the course of their life. Here too, other professions.
But depends upon handing long-term responsibility of the patient. But still it should be B, because but ongoing word is not given. Again, it is confusing me like hell. But let us stick to 35 B. But if it is A, I can't help it. It is kind of a tricky listening. I can't help it. So I'm just going to wrap it up. But it is a tricky listening, because then it says it depends on handing long over responsibility over to the patient. That is also being said. I don't know why. C is definitely not my answer. Again, I'm confused between two options. So that happens with me as well. We just need to go on and just let's do the last question and wrap it up. 35th, again, I'm sticking to B. I want to do A, but I don't know. Can't really help it. Let's see whether this question goes fine or wrong. But 34th, I'm sure. 35th, 33rd, I'm sure. 34th, I'm sure. 35th, I'm confused. Let's see.
This may be utilized. For example, in a case of an unequal leg length, a podiatrist could address this with a heel rise, shoe rise, or built-up foot orthotic. What patients expect to achieve and what is achieved varies.
Just a second. I have to check out my battery. It's just about to get over 7%. I have to recharge it. So I'm just going to hang it over here only, and we'll check this answer rather than going forward. And we can do the last question some other time. But yeah, because the battery is about to go away, so it's just about to finish. So I'm just going to go to this listening and we'll check out the answer. So 33rd should be C, 34th should be B, 35th, I don't know, it should be A or B. But this is about how to do listening. Sometimes it's tricky. It was a tricky listening for sure. 33rd is C, that I said. 34th is B, that's what I said. 35th is by chance given A, but it should have been B. But the only, that is the word of elimination, but the only word they would have eliminated is ongoing. Please understand, this is what I wanted to teach you as well, that it is elimination that helps you. As soon as I do not follow my elimination method, even I am in trouble, because this elimination method says that ongoing word is not given. So we will say, sir, it clearly said focuses on cooperation, focuses on partnership. That is where OET reading and listening is different when it comes to elimination method. That is what I want to teach you. That is why if I follow my elimination method, I am always right. 35th, if you will chuck the word ongoing word out, it will automatically reach to A. So this is what is the real technique of elimination. That is what, if you will realize in this, I had tried elimination in all the things. Even in the 31st question, why did I do wrong? Because I did not eliminated the word less. If I would, elimination method is the key. So that is it about today, but please do not ignore this lecture, because when your mentor does 2 or 3 questions wrong, there is something definitely that can be learned. And again, it's just about learning. So again, less invasive word, if you eliminate, you will reach to B in 31st question. 32nd was a difficult, I don't know, maybe I did not eliminate. C or A option should have been done. But 33rd, I could eliminate both the options. 34th, I could eliminate both the options, because 33rd ka C part was about realistic aims, that is third phase, and the second phase was talking only about the things, and there was nothing about other joints of the body. It was all talking about spine. So 34th was pretty short. 33rd was simple. That other first one, I'm just going to take it along because my battery is about to get over. So that's why I'm hurrying up. So yeah, 33rd, I was saying A should not be there because it is suspected time. And 33rd, I said that it should be 33rd. I said that B should not be option because it did not talk about exercise anyhow. 34th, C should not be an option because it was in the third phase. And A, it did not talk about new techniques. New word was not there. 31st A, less word was not there. And this is what you need to understand elimination, that ongoing word was not there. That is how you reach to 35th A, that handing the loan over long-term responsibility, then you leave the patient on its own. That was the sentence that was spoken. I'm just going to unmute you guys because I have done some questions wrong. So I really want you to participate and want to listen to your voice if you have learned something good from part B and C. So I have unmuted you guys. Any kind of feedback, any kind of things that you have learned in this session, because the more we do wrong, the more we learn. It's not about getting disappointed. It's about getting what we have learned out of the session. So that is what primarily I love to do, even if my questions are wrong. But again, it makes me firm again to understand when less invasive, less word is not given, when new word is not given in the joints, when exercise word is not given in the 33rd question, when ongoing word is not given in the 35th question. That is how you reach to the right answer. That is what OET reading and listening part C is all about. Have you guys all understood?
Yes, sir.
Yes, sir.
A part, that is what I'm telling you. A part is anyhow easy. A part is anyhow easy. Try to gain at least 20 to 22 marks in the part A. When it comes to part B and part C, use your elimination method. That is the best method which will help you to eliminate other two options and to reach to the third one, which seems like less of an answer. So that is how you should do. Again, part B and C, even if you do 2 listenings a week, but do it 3 or 4 times. It's better rather than doing more and more listening. So please remember these simple strategies for yourself, and listening part A, practice as much as you. I hope you all have understood. Is it good time to call it a day? Is it fine? And
Yes, sir. Yes, sir.
Yes, sir.
recording, even if you will do this recording, you will find my mistakes, you will learn more from it. Still I will upload this lecture, no matter what the audience think about it, but still I will upload this lecture for you all, because I know it's an important lecture to learn. So are you all good, guys?
Yes, sir.
Learned
Yes, sir.
something? Done. Okay, guys, then take care, and time to say you goodbye. Take care, see you, thank you.
Bye,
And
sir. Bye. Bye.
keep
Thank you, sir.
Bye, sir.
Thank you, sir. Bye,
Thank you.
sir. Thank you, sir.
Thank you so much, guys.
Thank you, sir.
Thank you everyone. Take care. Thank you.
Bye-bye.